He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Welcome, folks. It is the Stay Off My Operating Table with Dr. Philip Ovadia. We are joined today by Dr. Andrew Campbell, who, as best as I can remember from our nearly 200 episodes, is the very first person to talk about what we're fixing to talk about. And that'll be all I say. I'm going to turn it over to you, Phil.
Yeah, definitely excited to have this conversation with Dr. Campbell. We've had a few guests on now exploring, the issues of air quality and things like mold toxicity, but none of them have been a physician who has, experience with that. And especially, I don't think we can find a physician other than Dr. Campbell who has as much experience dealing with the medical consequences of mold and other environmental toxins. Very excited to have him on. Dr. Campbell, maybe you can start with a little introduction to our audience about your background, how you got interested in this area, and start, kind of the work that you've done, which has been really, I think, groundbreaking in this area.
Thank you. Yeah, I was educated in Switzerland, the southern part, Lausanne, where it's mainly French. And then I came to the United States, finished college in 3 years, went to medical school, and then trained in Orlando as a cardiovascular thoracic surgeon. Then I graduated prep school when I was 14. That's why I had a lot of time. So that's why the training and all that. Then I went to medical college in Georgia, clinical immunology, and then over on to Cambridge University in England for toxicology. And then I based myself at the medical center in Houston. I started seeing a lot of women of all ages, all sizes, et cetera, coming in with the same type of complaints. And this is era before computers were available. So I started staying late at night, going through their charts and trying to see what was the commonality. Why would a 25 and a 45-year-old female have the same set of symptoms? And that would bring them in to see a doctor. Make a long story short, I saw that they had silicone implants. And I looked all over the country. Of course, back in those days, it was calling via Ma Bell and all that, and found another MD in Los Angeles and a PhD in Los Angeles he had been seeing the patient, and the PhD had a lab where they tested. So basically we started publishing. We published in the early 90s 32 different studies on the effects of silicone on the body and the immune system, et cetera, and also on the molecular mechanism, why polydimethylsiloxane, which is a form of silicone, because silicone is like saying wine. There's white wine, there's rosé, there's red wine, there are all kinds. How does that lead to a lymphoma that only occurs in women with silicone breast implants? And then, then the NIH stepped in and asked me to come up and explain all that, so forth and so on. And then they shut down the manufacturing of breast implants because they had been grandfathered in as they existed since the 1960s before the FDA. And now they had to prove that they were safe. So the women would get explanted, but not always feel that much better, maybe 20% better, 25% better. And I said, there's something else here. So I found a PhD in Montreal, Canada, who spoke no English, only French, which was fine with me. And he was an expert in the failure of implantable medical devices. Why do knee implants, hip implants, chin implants, why do implants fail? So they can make new ones and correct the mistakes.
I'm sorry. My mom has had 5 hip replacements.
Yeah.
I've never heard anybody just say it that explicitly. I shouldn't be laughing. Go ahead.
So I invited him down to Houston And I asked them, what happens, because implants come in pairs, what happens if a woman hits the steering wheel? She's hit from behind, she hits the steering wheel, one implant pops, the other doesn't, and has to have them replaced. And they take both of them out, whether the intact and the non-intact ones. So he says they're discolored, the ones that did not rupture. And I said, why would they be discolored? He says, because they're full of mold. I said, what do you mean? How does mold get into the implant? He says, during the manufacturing process. And so sure enough, I started giving these ladies an antifungal, itraconazole, and the clouds parted and the sun started shining through in their life. And so this is how it all started. Then I saw families who says, I don't have implants, but my house has mold here and there. And so I now have over 100 publications on these topics, as well as three chapters in medical textbooks on the effects of toxic molds and the mycotoxins they make. So that's
and can't wait to dig into that. But I do have to ask, and I didn't know this before we started this call, that your background training as a cardiothoracic surgeon, what made you leave that field and go and pursue the training in, immunology and all of that?
Two reasons. One, I was still very young, having graduated. Actually, I graduated a month before my 14th birthday from prep school. And then I finished college in 3 years. So you can imagine I was a kid when I graduated medical school. And it was my first dream. And then I started getting interested in immunology. And I said, what the heck? I'm still young. Let me go do some of that. I was offered a great position with the 3 cardiovascular surgeons. But I said, no, and they were all older, obviously. And I didn't want to join a bunch of old farts yet. Now that I am one, it's different. But it was a very interesting time in my life, of course. And then I liked what I saw because no one else was seeing it. And this is why it was important to remain with the medical evidence. In medical school, they taught me, in God we trust. Everyone else has to show data. So I'm still with that mantra.
Yeah, and that's a great one. And unfortunately, I think all too often that's forgotten. And, we've kind of fallen into this trap of just someone says it's true and we accept that it's true and we don't go that extra step. So that's great to hear. Maybe we can talk a little bit about, we'll give a little sort of background and context. So these things that you're mentioning, silicon, mold, what problems does it cause? How does it cause these problems? And, what are some of the things that people maybe should be thinking about that might alert them to this might be an issue in their life?
So molds are from the plant kingdom. There's millions of species of mold all over the planet. They affect insects, trees, animals, you name it. However, there's only a couple dozen that affect humans, and many of this is only in an enclosed space, in a structure, such as a home, an office, etc., or even a car. So just like plants, you take some seeds from a store in a little envelope, they're not dead, they're dormant. And they take a pot, put soil, put the seeds, add water, and eventually something grows, and that thing that grows produces seeds. Same with molds. They're dormant. Then you get them wet, and if they stay wet for 24 to 48 hours, they start to make seeds, except we call them spores. And these spores carry with them a mycotoxin. So basically, human hair is 100 microns thick, so that the public can have an idea. Mold spores are 2 to 4 microns. That means they go into, when you breathe them, they go into everywhere, and mold spores are known to be inflammatory since the 1980s. Studies have shown that. They cause inflammation, and they're so small that go to the deepest part of the lung, right into the alveoli, the deepest parts of the lung, and transfer into the bloodstream, carrying these mycotoxins. First place they go to, the brain. They break down the blood-brain barrier, and then once they do that, they cause cell death, apoptosis, cell death of oligodendrocytes, astrocytes, etc. So you have this resulting in demyelination. For example, a study done at Rutgers University School of Medicine on MS patients, multiple sclerosis, showed that 70% had mycotoxins, a particular one called gliotoxin. If you test yourself for this and you find that, maybe by getting rid of it, you can prevent this. But more importantly, I've treated, and by the color of my hair, you can tell I've been treating for a while. I've treated many patients with MS. They come in wheelchairs, and a year later, they're playing volleyball. Basically, the principle is identify the cause, remove the cause, repair the damage. What happens? You're fine. As a surgeon, you do that regularly, vascular surgeon.
You used a word that I only know because I've been on this podcast with Phil now for 3.5 years, but most of our lay people are probably not familiar with. I think you said something about anti-myelination or
all your nerves are coated with myelin. It's basically like a wire, and this is a wire inside, and this is a plastic coating. All your nerves are coated with myelin. That's why they say that the brain is gray matter and white matter. The white matter is that coating. Now, if I take this wire and I start slicing off the plastic and exposing the wire, then whatever it's plugged into is not going to work as well. And demyelination means that these nerves that go to muscles and tell them to move or try to figure out and store things in memory, etc., don't work as well. So that's that sheath, that covering of nerves.
Now, I was under the impression, no doubt due to my extensive medical training, that's sarcasm, folks, that once a nerve had been demyelinated, it couldn't be fixed. And that's what I'm hearing you say is that is not true.
That's correct. Two reasons. And I wrote a textbook on this 25 years ago, 2000, on intravenous gamma globulin and how to give it, administrate what it does and how does it do that, etc. That's one. And there's been what is the gold standard in medical publications, and I'm the editor-in-chief for 5 medical journals, the double-blind, placebo-controlled, randomized study. And if you like, I can explain it, but essentially...
That one I think we know.
Okay. So on certain things like phosphatidylserine, that it helps remyelinate the brain. So when I see a study like that, and I give it to patients, and they email me back within not that long a time and say, wow. And, again, I've been doing this for a while, so I've done it many times. And I'm almost up to 18,000 patients for mold and mycotoxin issues.
Brain, neurologic issues. What are some of the other commonly affected organs from these mycotoxins?
Okay, for example, let's stay with the brain just a minute. In children, pandas, autism, study from up in Boston, there's 2 medical schools, Harvard and what's the other one? I forgot. Anyway, they did study on 172 autistic children with 60 controls and found mycotoxins in the 172 and none in the 60. Now, it's important to know how to test because there's a lot of internet, and the internet is full of opinions and it's full of anecdotes, but lacks medical evidence. So there's 2 basic tests. One is a blood test for antibodies for toxins. Now, we have to remember something that many MDs even don't know. When we were in medical school, we were taught in microbiology that if there's 4 pathogens, bacteria, viruses, pathogenic fungi, and parasites, and if you were ever infected by any of these, you leave in memory an immunoglobulin G antibody. So if you were 5 years old and had a viral illness, you're going to have in your blood antibodies to that particular virus. Not so with toxins, because these 4 pathogens are living organisms with cell membranes, etc. Toxins are a molecule. Hg, mercury, just a molecule. Glyphosate, arsenic, As, just a molecule. Mycotoxins, just a molecule. So the immune reaction is completely different. It only reacts if it's doing damage in you. Then when it's gone, you retest and those immunoglobulin Gs go down. And then they're gone. There's 2 responses to toxins. One is immunoglobulin G, which indicates a current toxic reaction in that person's body. And the other is IgE. Now, we were taught for IgE, that's your typical allergic reaction with histamine, heparin being released from mast cells and other substances. In this case, when you have an IgE antibody to a toxin hit a mast cell, it starts releasing what we call in medicine pro-inflammatory cytokines. This is like interleukin 6, interleukin 17, etc. Basically, it's like an email blast to the immune system, cause inflammation. And where does that inflammation occur? 3 areas of the body: the brain, the gut, and the skin. Then people start chasing histamine and this, and then it eventually develops into a mast cell activation. From mast cell activation, you get mast cell activation disease, mast cell activation syndrome, mastocytosis, unless you get rid of the problem. So what's the first rule in toxicology? Get the patient away from the toxin or the toxin away from the patient. So in the brain, we now have evidence that Parkinson's, Alzheimer's, and amyotrophic lateral sclerosis, Lou Gehrig's disease, are caused by mycotoxins. Specifically, a study showed that Lou Gehrig's disease, ALS, 5 to 10% is genetic. The rest is all due to mycotoxins. The other part of Parkinson's, and again, if you want, I've got a few slides if you want me to show you the slides, and they all have the study where they're from. So none of this is opinion or anecdote. Anyway, so there's on Alzheimer's disease, they found the same thing, which makes it easy for me because then I treat patients with Alzheimer. And if it's not the severe, there's 3 levels: the beginning, moderate, and then severe. If it's just under the moderate to beginning, most people get well. Same with ALS, same with Parkinson's. And again, I've done this and I've published this. What other things? What about chronic fatigue syndrome and fibromyalgia, which are basically wastebasket diseases? You know, oh, you have this, we'll run the same test I run on everybody. And yes, you have fibromyalgia because I can't figure it out otherwise.
Right.
So, and same with chronic fatigue syndrome. Everybody gets fatigue. I get tired sometimes too. But this chronic fatigue is a fatigue that's a profound fatigue. One of the most common symptoms, the first symptoms patients feel from mycotoxins is fatigue, brain fog, sleep disturbance, anxiety, depression, short-term memory loss, etc. What about POTS? What about autoimmune disorders? Let's say a person comes to you and they have psoriasis, huge flakes falling off their body, the skin, and they have rheumatoid arthritis, and the fingers are swollen, painful. You ask a rheumatologist, they'll say, poor thing, I'm going to put him on, immune suppressing drugs. What if it's caused by mycotoxins? And I have all of this before and after pictures of patients. Photograph, this is what this woman's legs look like with psoriasis plaques. And this is what it looks like 6 months later. It's normal skin. Again, it's not that difficult once you look for the cause and find the cause, and then you repair the damage. So autoimmune disorders, of course, as I mentioned earlier on, breast implants. And I can show you pictures of breast implants, and you look at that and you say, yeah, that looks exactly like mold inside.
Wow.
And first I'll just ask, what about heart disease? Because obviously that's a focus for us. And maybe even more broadly, some of these metabolic diseases like diabetes. How much of a role do you think mycotoxins may be playing in those?
Let's take the diabetes one first, because that's easy. Type 1 diabetes is an autoimmune disease. Same thing as all the autoimmune diseases, you can get rid of it. Hashimoto's. And these people exercise, they eat carefully, etc., and they still keep gaining weight. The doc has trouble adjusting the dosage, etc. Why don't you treat the cause, mycotoxins, and the Hashimoto's goes away. Let's focus on the heart. We're AFib, atrial fibrillation, as an example. What happens if you demyelinate some of the nerves that tell the heart muscle to beat? It won't beat normally. So you're going to have atrial fibrillation, you're going to have PVCs, premature ventricular contractions, you're going to have all the disorders of rhythm, heart rhythm. Same with the vagus nerve. Demyelinate the vagus nerve, you're going to have all kinds of issues with the movement of the bowels. And you know that because before you started operating on the heart, you operated on the abdomen, like we all do.
Yeah.
So having said that, what's the other mechanism? You have something that, a substance, a molecular substance that enters cells, including muscle cells, including cardiac muscle cells, and dysregulates the mitochondria. When the mitochondria is dysregulated, it causes cell death, or what we call apoptosis in medicine. So those are things that happen. And let's go to the vascular system. Let's go to the endothelial walls inside blood vessels. Okay, so when you have that, you also start to have issues when you have mycotoxins. You have issues with the endothelial cells, etc., and they start failing. Because again, these are toxins. These are not friendly. They've got tattoos all over their body. They've got rings in their nose, eyebrows, lips, belly buttons, and God knows where else. They hang around at all hours of the day. They carjack. They're bad people. And some people say, which one is worse than the other? I said, does it make a difference if you get hit by a car doing 75 or 85?
Doesn't make any difference.
Yeah. How do we, and one of the air quality people that we had on this show previously, put out a statistic that probably 80% of the buildings in the United States are, infected with mold or have, other toxic issues with the air. So how do we start to separate, if almost everyone is exposed to these things, right? And we're seeing all these diseases, how do we start to separate in which cases, the mold is causing it versus the mold also happens to be there, but, there may be some other causes to these diseases?
In medicine, we usually determine that by a blood test. That's how we determine many things, because blood doesn't lie. Can't fake it. Regarding indoor air, we mentioned that the spores are 2 to 4 microns. Mycotoxins are 0.1 micron, the same size as a COVID virus. So if people say, what about an air filter or something like that? There is none, because otherwise it would have been used all over the planet during the pandemic. Having said that, indoor air quality, what happens indoors, again, is a water intrusion is that begins this whole mold thing. Now, I've seen patients from Dubai. If you go to Dubai, it's a city in the middle of a desert. You leave Dubai, it's Lawrence of Arabia, all desert. What about Phoenix, Arizona? Where outside it's gravel and sand, cacti and lizards and snakes. It's construction. That when I studied in Switzerland, and then I came to the United States, my brother stayed and he became an architect. And he comes over here, he says, how can they possibly build a house in 6 months? It would never be allowed. If you ever go to Amsterdam, the whole country is below sea level. And Amsterdam is full of canals. But you look at the houses, and at the very top, it tells you what year they were built, 1592, 1617, etc. Yet they're next to a canal and a country that's below sea level, and it rains. Why is there no mold? Because the house is made with stone, not plaster, not drywall, not wood, stone. And it's about 1 meter thick, about 3 feet thick. So nothing gets in through that. That's why they're mold free, etc. So it has to do more with construction, and you ride around and see apartment complex, they start on it and then it gets off. And then, they leave the drywall outside and it rains. That's giving a gift to mold, because mold loves drywall. It's organic.
You lost me on the stone walls. And this is just, I'm exposing my ignorance, but a lot of our audience is going to be having the same questions. I live in Phoenix, and the only place I've ever seen mold is under my faucet outside that drips. And I've got this ground this space about the size of a dinner plate that's actually got some kind of mold growing on it. So it makes sense to me that wherever water stands, gathers, accumulates without, I guess, being refreshed regularly, that mold could grow. And I may be following a rabbit down a trail that's not necessary to follow, but why does that make stone houses different? Or maybe I missed something important.
So today, houses usually have at least 2 or more bathrooms.
Right.
All those are potential leaks. It can be a drop an hour. What about houses today have the washer and dryer indoors, inside the house?
Yeah.
I've never pulled the washer and dryer out to see if there's a leak behind it. What about refrigerator that spit out ice and cold water and all those things? Those are hooked to a water supply. How many people actually pull out that refrigerator, check behind, make sure that there's not been a little tiny leak? And how many people actually go to wherever they have a faucet, open the cabinet underneath, and feel the floor of that cabinet to see if it feels a little moist or wet? Nobody does that. What about checking your dishwasher? What about the seals on the washer and dryer? All those things become potential sources.
That makes sense. And it sounds, just leaping ahead here in the thought process, just because I haven't found water doesn't mean I don't have it standing somewhere. And even if I can eliminate the source of the water, that doesn't necessarily mean that I've eliminated the mold, at least not right away. So the question that I have is, let's assume that I've been contaminated with mold. My body has, from whatever source, and I haven't been treated. It seems like I'd want to treat both my body and my environment. Where do you start?
First rule of toxicology: get the patient away from the toxin or the toxin away from the patient. You don't clean the mold. You have to completely remove that. Otherwise, they'll grow right. People think that by applying Clorox, which is 95% water, that just drives the mold further into that linoleum, wood, whatever you have it on. And this is not uncommon. 80%. I can show you a New England Journal of Medical study that says it's 80%. But yeah, I'm not going to argue with the New England Journal of Medicine.
Yeah. So you mentioned, we started talking about the blood testing, but then we kind of got off of it. What is the proper blood testing for people to figure out if, they're having the toxic effects from the mold, right? We said it's kind of ubiquitous. Almost everyone's probably exposed to it. How do we figure out who it's a problem for?
I understand your question. The blood test, and it's by a laboratory called MyCoLab, tests for 14 different mycotoxins, both for the Ig reaction and the IgE reaction. A study that came out in the journal Toxins in October of 2022, 2 years, 3 months, they looked at urine testing versus blood serum testing. And after analyzing it, they said, really, for urine, you have to do several tests throughout the day. And since it's based on creatinine, there's a difference in creatinine according to age, gender, muscle mass, and age. And we know that from basic physiology, first, second year of medicine, that creatinine will change. So they're saying it's a highly inaccurate test. And then what they said about the serum blood test is, hang on one second, I'll read it to you. They said it was the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. That's what we want in a blood test. Having said that, almost 18,000 patients have been using the blood test, and it is really right on. And here's the thing, the good part. The good part is that there's treatment for this. And then at the 6 months of treatment, once they're out of the moldy area, or you've gotten rid of, remediated the mold, 6 months later, you take the test again. It's down to 0. So you know what's going on at the molecular level in the body.
Would it make sense to treat for mold in the body prior to having identified the source external to the body?
No, because as long as you're exposed to mold and the spores it creates, I mean, it's okay. Let's say it's mercury. Let's change from mycotoxins to mercury. And you work in a lab and you've been poisoned by mercury and you continue working in the lab. You can treat and chelate mercury, but you go back the next day, it's right back again.
Okay.
So it doesn't help.
And so again, people that are dealing with some of these issues, how do we select, right? Again, we'll take, what I deal with, right? Heart disease. Should everyone with heart disease be testing to determine if they have mold toxins, or are there other maybe features that, will alert people that they should be tested, and this may be an aspect? Because again, you kind of start to think if almost every house and structure has it, right? Maybe the answer is we should be testing everyone. But I'm just wondering, as clinicians, right, is there a way for us to be more selective when we're dealing with these chronic illnesses that can be associated with this?
Yeah, I'll answer that. easily. Here's the issue. Every single one of us has a different and unique immune system. Even if we were monozygotic twins, they'd be different. And we've all heard of couples that catch the flu. And one is fine after a couple of days, the other one's in bed for a week. Same flu, two different people. By the same token, some people have a really robust immune system, and other people don't have as one. We know that 80% of the immune system's in the gut. Let's take it down to birth. What's the first thing that happens to a woman when it's due? Water breaks. That water contains acidophilus and coats the birth canal. Why acidophilus? Because women may have yeast, and acidophilus kills the yeast, so it doesn't affect the baby, the newborn. So in the newborn, the first bacteria in that baby's mouth are mother's bacteria. And what that does, that starts the microbiome. Now, the first 3 days after birth, mother's milk is colostrum, which has huge amounts of antibodies from mom to the baby to protect the baby, as well as an oligosaccharide, a sugar, but not sugar in the sense of what's in the sugar bowl. And that oligosaccharide cannot be digested by the stomach of the baby. It goes on to the intestines and starts feeding the microbiome. What happens if it's a C-section? And C-sections are more popular in the United States than all of Europe. Why? Because the baby's going to be born in December. I know the OB-GYN is going to go on vacation skiing, so I'm going to have it early December by C-section. Convenience, etc. But whatever. C-section, the first bacteria in baby's mouth are from operating room personnel and instruments. So the microbiome doesn't develop like it should, and therefore you have issues. This is where children have more allergies, have issues with milk, have problems when they're 6, 7 years old going to the allergist for all kinds of shots, etc. So that's one part where we can tell if the person has more propensity to have a problem or not. Second is we have to look at symptoms. As doctors, first question, chief complaint. What are you complaining of? What are your symptoms? And one thing that I've never seen a patient for the first time that has not seen at least, I don't know how many doctors. The average is 8, but I've had those that have been to 20 or more. Why? Because they get tested, they get treated, and they're still sick. Then they go try somebody else. They try somebody else, on and on. And there's, as you know, a whole bunch of experts on the internet. Their expertise is in marketing, not in medicine and not in science. It's in marketing. But people fall for that. You have to be a clinician, a doctor, to tell and say, okay, this chronic fatigue syndrome is from truly a virus. But then here's the other part of that. If you're positive for mycotoxins, that will cross-react with viruses. So Epstein-Barr virus, cytomegalovirus, HHSV6 virus, all those tests will light up as positive, but it's a cross-reaction. The person doesn't have that.
I don't know where to go from here, Phil.
You're saying the mycotoxin is the true issue, but that might get missed because we don't commonly test for that. We test for those viruses, like you mentioned, and it ends up sort of distracting. We think we're dealing with a viral illness, and in fact, it's actually a mycotoxin illness.
I lecture at medical conferences all the time. Next one. is this coming week. And then it's Charlotte, North Carolina Research Center. And after that, it's Chicago for the International College of Integrative Medicine, et cetera. I mean, I sometimes stay and listen to these others that talk about chronic fatigue syndrome. And they tell their patients this is a lifelong illness.
Yeah.
I'm sorry. I don't accept that. And one of the reasons you're a cardiovascular and thoracic surgeon is because you don't accept it either. Go die, your heart's no good. You don't do that. We don't do that. So for the same point, why does the World Health Organization call mycotoxins the great masquerader of this century?
I'll bite. Why do that? Is that what they call it?
Because it mimics so many other diseases. So what do doctors do?
Quick question on that. Does it actually mimic the disease, or is it really more at this layer of testing and analysis? That's what the disease is, and all we got to do is go another layer or two deeper, and we see the root cause is actually mycotoxins. I guess my real question is, are there an awful lot of symptoms and syndromes that have gotten labels, different labels, because they present differently, that all have the same root?
Many have the same root. Yes. I mean, we've all seen it. And as we are in medicine and see patients, the more patients we see, the more agile we get. You know, my first appendectomy took an hour and a half. You know, why? Because it was my first one. Later on, I got pretty good at it. You know, it's like that. You know, now I can do things in medicine with my eyes closed at 3 o'clock in the morning. So the point about the layers is that 20 years ago, only MDs and DOs could order tests. Today, you could be a naturopath, chiropractor, a life coach, and order any test you want. How much training have any of those people had in immunology or disease pathophysiology and those things? I mean,
well, your point is fair.
You go to a naturopath and you have a bronchopneumonia. They're going to give you herbs, and I mean, you're going to die if you don't treat that with an antibiotic. It's not a unknown. You know, when you have a lot of people ordering tests that they've never really understood. I mean, yes, all of us that went to medical school were taught basic immunology. So we know how it basically works. But what happens if you never took a course in immunology? You have no clue. So you start going on the internet after work and trying to find websites that say, do this, do that, do the other. And if you order it from me this week, it's 20% off.
That's fair. However, I have both personally and professionally interacted with lots of guys who've got education and training out their wazoo, who will stand up and pound the podium and insist that diabetes is a lifetime disease and you're stuck with it. You have to learn how to manage it. So education and training, as far as I'm concerned, that you may as well just be saying, trust the experts. We've learned over the last 5 years that the experts are pretty good at whoever writes the check, whoever pays the piper calls the tune. And what I'm looking for is how, our audience here is primarily people who the medical industry has failed, because there's been lots of doctors who've told him, oh yeah, here's your drug, here's your problem, take this drug. Here's your problem, get this surgery. Oh, the surgery didn't fix it. Here's another drug. Oh, the drug didn't fix it. Here's another drug and another surgery. And they're tired of being on that treadmill. And an appeal to authority doesn't work for these people anymore. We want facts. We want facts we can trust. We want facts we can test. We don't want to be told, trust the expert because he's got a degree after his name.
I agree.
Those are the people who've been lying to us for a really long time.
All about cholesterol.
Like cholesterol.
Yeah.
Exhibit 1A.
and lipid lowering drugs, and they're I'm
Yeah.
looking at those. And one of the people who really is an expert in the sense of combating these other dyed-in-the-wool experts is Dr. Bob Lustig.
I've seen that name.
Yeah.
Bob Lustig is a pediatrician and endocrinologist. In other words, pediatric endocrinology. Years ago, he brought to the forefront all this stuff about corn syrup and how it's really not good for you.
Yeah.
High fructose corn syrup. He's written a book called Metabolical. And the book Metabolical means how it's diabolical what we're doing about the metabolism with all the BS that's out there from these so-called experts.
Yep.
He shows it very clearly and hits on heart disease, cholesterol, diabetes, and all these things. And he says, you're not treating the cause, you're just giving them pills. Yes, I agree with you.
Yeah, no, Bob is great, and I don't know why we haven't had him on the podcast yet. I gotta reach out to him. But I wanted to kind of, close the loop here for our audience. We talked about, okay, so now we've figured out, proper way to test, and first step is, remove yourself from the toxin or remove the toxin from your environment. So my first question would be, is that enough in some cases? And then you're shaking your head no, just for our audio audience. So what does the treatment look like then?
4 steps. The first one is the one you mentioned. Clean up the environment, because otherwise, remediate it, remove. Don't clean those tiles, throw them out and put new ones. Or the flooring. Throw out shag carpeting or anything like that. Or wallpaper. But I'm not a building engineer, so I'll stop there. But get rid of it. Second, take itraconazole, 100 milligrams twice a day. Now, I have 2 comments on that. One is, all over the internet, your eyeballs are gonna fall out, your teeth are gonna fall out, your liver's gonna fry, and your heart is gonna quit if you take this drug. Why? Because it works, for one. However, in 95% of my patients, it's fine. There's 5% where it's not fine. Why? Because it's a generic, and generics are made in 2 countries, India or China. And every once in a while, there's a batch that comes out that does something. And so I switch them to Sporanox, name brand. And their problems go away. Third, they need 8 specific supplements and vitamins at specific dosages. It's not something you go buy at the vitamin shop or order online or something like that. For instance, magnesium. I wrote an article on magnesium a while back. There's 6 types of magnesium. Magnesium is involved in 350 plus enzymatic processes in the human body. And you may not be deficient, but you may be insufficient in those levels. What happens if you're insufficient or deficient? You can't absorb vitamin C. And as humans, we don't make vitamin C and we can't store it. So we have to get it externally. But if you read what Dr. Linus Pauling wrote about vitamin C, he won the Nobel Prize twice, so it's worth reading what he wrote. He says these 250 milligrams of vitamin C, 500, that's nothing. That's like taking a cup of water and pouring it into the Pacific and expecting it to rise. No, you've got to take it in grams, 1,000 milligrams. That's one example. Why? Because it's a great antioxidant. And what do mycotoxins cause? A lot of ROS, reactive oxygen species. And so those go way down. Mitochondrial function comes up. Remember, we talked a little bit ago about the gut and how important that is. Dr. Simon Cutting at Reading University in London did tests about 8 years ago, 2015, 16, somewhere in there, on all these probiotics that are sold in stores, sometimes refrigerated, many times not refrigerated, but basically two, lactobacilli and bifidobacterium. What he found is that more than 90% die in the stomach. He called it dead bacteria therapy. Let's remember that the acidity in the stomach is part of our innate immune system, because you watch any baby crawling all over the floor where people come inside from outside, dirty shoes, walk across, and that kid crawls all over that, puts his fist in his mouth and anything else in his mouth, and does not get infected because he swallows that stuff and it's killed by the gastric, the low pH. So he investigated what does create a good probiotic. And remember, probiotic means pro-life. And it was developed by Dr. Ilya Mechnikov, a microbiologist at the beginning of the 1900s, and he won the Nobel Prize in 1905. He went to a small town, village in a country called Bulgaria because he heard that people lived to the 80s there. And in the late 1800s, early 1900s, people who were 50 were really old. And he tried to figure out, they had a hard life. It was cold, etc. But what made them, they ate a particular kind of milk. They did something to milk, and it's called yogurt. In Spanish, it's still called leche bulgar, Bulgarian milk. So he found that out, but that probiotic is so important for the gut. Again, Dr. Simon Cutting found that spore-forming bacilli really reach and make a good microbiome. What happens if you don't have a good microbiome? Let's take an amino acid. We have 20 amino acids. Amino acids is like the bricks that make the house called protein, which we all need. There's a few that are essential, meaning we don't make them, like tryptophan, L-tryptophan. We have to get it from outside red meat, chocolate, eggs. L-tryptophan, when it gets to the normal microbiome, gets converted, helps a neurotransmitter. And that neurotransmitter is a very important part of our happiness. What do psychiatrists give in their pills to depressed people?
Serotonin-specific reuptake inhibitors, which I question whether they really know if it's specifically limiting the uptake of serotonin, but yeah.
Read my article on psychiatry. So yes, serotonin, our happy neurotransmitter. And from serotonin, you derive melatonin, which helps us have a better night's rest. What happens if you don't get this absorption? You get depressed and your sleep is affected. So it's not very complicated if you take it down to the molecular level, or because in medical school we're taught organ level and cellular. Now, honestly speaking, we're looking at molecular level in many areas of medicine. So that's a simple explanation, because that microbiome healthy keeps you healthy.
Does the yogurt allow the probiotics to get through the stomach? Is that why
they're killed in the stomach?
So why does the yogurt survive? Why does the yogurt help
because of the stomach acidity. But let me ask you another question. In the United States, if you sell any milk or dairy product that's not pasteurized, people come visit you with blue jackets and yellow letters on the back.
Yep.
Yep.
What is pasteurization as developed by Dr. Louis Pasteur in Paris? Means heating a substance so that you kill all the bacteria.
Right.
What happens if you heat what are you getting in that yogurt? It's been pasteurized.
Right. You're not getting anything. We've had Dr. William Davis on a couple of times, and, he talks about this as well. And, it just, in the end, you start to realize that, our bodies and specifically our immune systems are being attacked from so many angles these days, between the foods that we're eating and, all of this stuff. It's kind of amazing that any of us survive.
That's what Bob Lustig says.
Yeah.
We're salmon swimming against the current. But let me conclude, because I said there's 4 steps.
Yeah.
Before the 4th step, you've got to find out if that's what you're dealing with. So you do the MyMycoLab blood test. Then if it's positive, you know what you're dealing with. And anyone can order this test, even patients, because today that's how things go. Then you do step 1, clean the area up. Step 2, the antifungal, itraconazole. Step 3, 8 specific nutrients and vitamins at specific dosages, not what they're trying to tell you on the internet. And 4th is you've got to have a diet, a nutritional diet, not a diet as in weight loss, but a nutritional diet that's anti-inflammatory and low in histamine. The first 2 months, people don't feel anything because they're in the negative. They've got to come up to even. It's like you had $1,000 in your checking account and you spent $2,000. You got to bring it back up to 0 first. And then build up. After 2 months, they start, oh my gosh, I woke up today, then I noticed this and this. And at 6 months, they're done. Now, you as a doctor can understand that when patient comes to you and they're 30 and they're in a wheelchair because of MS, and 6 months later, they walk into your office.
Amazing stuff. Yep. Life-changing.
What it means, why did we go and do all these years of, you don't get in to even a good college if you're just a mediocre student. We had to really study our nuts off. And when our friends said, come on, let's go to the movies, let's go to the beach, let's go have a beer and all these things, we said, no, I got to study. We gave a lot of stuff up for this. And then when we see that, we can say, I made the right decision. I became a doctor.
Yeah, definitely so. And that's a lot of what we talk about here, and, really getting to the root causes of diseases and helping people, truly heal, not just covering up the symptoms with some medications. So this has really been amazing. And, I hope it gives people hope, right? That's really what we're trying to do, because way too many people are struggling with these things and they're not getting the answers and they're not figuring out what's really wrong, and they've lost hope. And so what we always aim to do here is give people hope that they can get better, they can recover. And this is, I think, another piece of the puzzle that it doesn't get looked at often enough.
Can you allow me to share screen so I can show your listeners know, but your visual listeners, yes, pictures before and after?
Yeah, attempt to share. If it doesn't allow you, I have to change the switch. I think I've got it turned on, but go ahead and try it. There we go. Hooray.
Yep, perfect.
Here's a young woman, 30, and you can see this is SIBO. Prior to starting and after starting itraconazole. So she wrote this. She took these pictures and wrote this. Then I'm going to show you a picture of what mast cell activation looks like.
Wow.
Young woman, before and after. Let's take another one. You see, this is a man, he's about 55. This is psoriasis. He's had it 15 years. Look at his ring finger up here.
Yeah.
Rheumatoid arthritis. And this is known in medicine as psoriatic arthritis. Here's his chest and abdomen. And here's his finger. 6 months of treatment.
Wow.
And then this
That's
is
life-changing right there.
This is the mother of a doctor, and you may have actually done a podcast or not. I don't know, but he's a great guy. This is his mom, and he says, Andy, can you help my mom? This is psoriatic plaques. And then she sent me this picture before and after.
And this is strictly from treating for
Mycotoxins.
mycotoxins.
Right.
For those of you who are listening, that little 2-minute bit there was definitely worth going to YouTube and watching the video part on. That was astonishing. That was definitely one picture being worth several thousand words. Okay, so that leads us to one of the things we'd like to do on this show is make sure that folks who want to take action can take action. You've stimulated some questions, you've answered some questions, you've given people a reason to do a little bit more digging. What would you recommend for folks to kind of do their own early self-diagnosis, see if maybe they need to pursue this mycotoxin poisoning?
Just a couple more things that I think they will help them.
Yeah.
Here's a study. It was published in this journal. Fungi found in 35 different cancers. So this is 17,401 patients with tissue, blood, and serum samples for 35 different cancer types. And what were some of the cancers? Esophageal, pancreatic, breast, lung, melanoma, ovary, colon, brain, and bone. But that's just a few of the 35. And I'm going to show you a picture of a gentleman's forehead. The left two pictures are the cancer growing on his forehead.
Good God.
And it's day 59 of itraconazole treatment. On the right two pictures, before and after, you see the difference.
And is this drug just taken orally?
And this is what a breast implant looks like when it's removed.
Oh my God.
Okay. So I show these mainly for not only you, but mainly people out there who's suffering. And you can take something that gets rid of your cancer like that.
Yeah. That's pretty impressive.
Definitely. So
it's from the journal. It's not my picture. It's not my patient. It's from the journal.
Yeah. Yeah. So I guess, how can people connect with you? And do you also have resources for people to find other doctors that, know how to do what you do?
Correct. So the first thing to do is get the test and get it from here.
mymycolab.com.
So
we'll make sure that's in the show notes.
And in all disclosure, I'm their medical advisor, but I don't get paid because I also teach faculty at 4 different medical schools. And if I had any contact of a commercial type, I couldn't teach. I have to send them my tax report every year. So I don't get paid. The other part is you do the test, you get to speak either and go over the results either with me or with one of my associates to go so that whether you're a clinician or a patient, you get an explanation and you're not just left out there to hang dry. And then also we can share with you who knows how to treat this, because there's a lot of so-called experts, as you've mentioned several times, and they know. I mean, I can show you PhDs who go out when it's raining and forget to bring their umbrella.
We've been exposed to a lot of those over the last several years.
Said. Great. mymycolab.com. And again, we'll put that in the resources. And to find more of your work in particular.
I have a very simple email, immunedoctor@gmail.com.
Okay, you realize that we have tens of thousands of people who will watch or hear this. You really want to give out your email like that? I mean, I don't mind. If you want to, it's your inbox.
Jack, I get about 50 emails a day. I answer every single one.
Okay.
These are afraid people. They're scared. They're nervous. They're afraid. They don't know what's wrong with them. They've spent a fortune going from this to that to the other and all these wasted tests. Do you know how many tests are out there that are invalid? They're not validated tests. And yet people order them. Clinicians, because they don't read the journals like I do. I mean, there's this whole Lyme thing. What they did with Lyme, the Germans, okay, you open and close a Mercedes door, what engineering, they're fabulous. They got all the Lyme doctors and various public Lyme groups together and came up with a criteria for symptoms, signs, testing, and treatment. Symptoms is signs are what you find on physical examination, laboratory, and testing. Once they got all that together, they sent it to all the specialists in Germany, the head of specialists, the head of cardiovascular surgery, the head of general surgery, the head of obstetrics and gynecology, head of pediatricians, etc. And they said, we want you to either agree, make changes, whatever. When that whole thing happened, they came up with a consensus. They decided to send it to their colleagues in Austria and go through the same process. When they got that back and both the Austrians and the Germans agreed, they decided to send it to the Swiss, the real precise people that make watches. Okay? And the Swiss, okay, so here's the key. They said all the clinical trials show the following. And then they list it by country. In the United States, there's only one laboratory that has a valid Lyme test. It's Immunosciences Laboratory in Los Angeles. Second, treatment even for neuroborreliosis, which means it's affecting your brain, is 3 weeks of antibiotics. And they all say, if after 3 weeks it didn't help, look for some other cause. But a lot of these Lyme doctors, everything that walks in the door is Lyme. They're like a hammer. Everything looks like a nail. And they use the wrong test, and then they want you to have IV antibiotics for 6 months. And I've seen so many of these. They don't have Lyme. And not only that, but the antibodies to Lyme stay on for several years. But those doctors repeat the same test. Of course, the antibody, the IgG, it's a bacteria. The IgG is going to still be positive. It's a racket.
Ooh, yeah, that's kind of what it felt like.
There's a lot more that we can get into, and we might have to have you back for part 2 to certainly get into all of that. But I think people are certainly going to be able to take away a lot from this one. And I thank you for all this amazing work that you've been doing. And like I said at the beginning, truly groundbreaking. And I don't think we could, if we wanted to, I don't think we could find an expert in all of this. And your thoughtful approach to it is really refreshing and eye-opening. We'll definitely encourage people to check out your stuff, get the testing done if they have reasons to be worried about this, and find good practitioners that can help them.
Keep fixing hearts.
He's Dr. Andrew Campbell. Your host is Dr. Philip Ovadia, and this has been Stay Off My Operating Table We'll make sure all that contact information is available in the show notes. Thanks for joining us. We'll see you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.